Hi everybody, I'm Dr. Lindsay Fisher from Total Performance Physical Therapy. I wanted to today go over a pregnancy core workout. As probably some of you have known if you've been watching, I'm 23 weeks pregnant right now. And so I thought I'd show you a couple exercises that are safe to do while pregnant. And I wanted to start by saying I highly encourage you to work out while pregnant, to perform core strengthening while pregnant. It's very important throughout the whole pregnancy and the delivery and after. So I highly recommend it. If you have any questions or issues or concerns, please consult with your doctor first regarding whether or not it's safe for you. I would say for the general population it is safe, but you may be a special case where you can't do certain things. So please check with your doctor first. But I'm gonna show you things that are generally safe to do. I will say that in the first 12 to 14 weeks, you're pretty much safe to do what you were doing before. You won't have a visible belly really yet, so you can do what you were doing. After that 14-week mark, you really don't want to lie on your back a whole lot to do these exercises. So I'll show you some alternates that you can do to keep your belly strong. What our abs do during pregnancy is act as a corset for our midsection. So it actually is going to help protect everything. It'll help protect the baby, just help protect us. It'll actually decrease low back pain. Generally when we're pregnant, we have big belly here, so we tend to arch the back more, and you actually get more back pain. So by having a strong core, you're not going to go into that posture as often, and you can actually limit your low back pain during. Strong core can actually help during the labor process, during the delivery process, and it actually has been shown that you will recover quicker by having a strong core. So I highly recommend doing these exercises throughout the pregnancy, and I will show you some of them that I recommend. First off, I will say what to avoid: any crunching motion. So any motion where you are crunching up, lying on your back, any full sit-up, do not perform it. It puts too much pressure into your abdominal area, and actually it can cause a separation in your core, and you can actually have some organs kind of jut through. So you don't want to. This is known as diastasis recti, happens in a lot of women, but by doing crunches, by doing sit-ups, it can happen more often. So please avoid this if you're pregnant. Also twisting motions, so Russian twist type things where you're sitting and you're twisting, those are not recommended during pregnancy. But I'll give you about 6 exercises that I do recommend. The first one is a pelvic tilt or abdominal bracing. And if you have a ball, you can sit on it. You can sit on a chair. You can do this lying on your back if you're, if you feel safe doing that. But the first one, what you're gonna do is flatten your back, suck your belly button towards your spine, and you'll feel these muscles in here tighten. You're gonna hold that for 10 seconds and then relax. And you're kind of tilting the pelvis as you're doing it. Make sure you breathe. So notice I'm talking as I do it. A lot of people will go into it and hold their breath. This will cause an abnormal amount of pressure in the belly too. So make sure you're breathing. Hold for 10 seconds and then relax. This is one of the most important things you can do. Very simple. You can do it while driving your car. You can do it while sitting on a couch. If you have a ball like this, it'll just bring in a little bit more of a difficult factor into the exercise. Okay, so that's number 1. Number 2 is a bridge. What you're gonna do is just lie on your back, knees bent, and you're gonna push the hips up towards the sky and hold for a count of 10 and then back down. Okay, 10 count and back down. If you want to make this harder, put one foot up in the air, bridge up towards the sky, hold that, and then back down. And do the other leg as well. So that's a bridge, okay? Next one is a plank. I feel safe doing a plank, so I'm gonna do it. If you have any concerns in doing this, consult with your doctor, like I said. If you ever do notice during a plank a coning of your belly, I would stop, because that means that you may have separated those abs a little, which is very common in pregnancy. So make sure you're aware of that during this. So you can either go on your forearms or on your hands, and you're gonna hold nice and flat, holding that belly. Make sure you breathe during this, okay? And I would hold for about 30 seconds to start. If you can work up to a minute, even better. To modify this, you can go on your knees. So same thing, either on your hands or your forearms, and on your knees here, flat like a table, making sure you're breathing through it, okay? Next one is a side plank. So many of you have probably done this. Once again, on your elbow or on your hand. I'm gonna go ahead and do it on my elbow. And what you're gonna do, feet together, stacked on top of each other. If that's a little too hard, you can put one foot in front of the other. But try to stack on top of each other, push the hips up towards the sky. Arm can go in the air, or arm can be rested on the side. All right, and hold that for 30 seconds to a minute. To modify this one, same thing, just bend the knees and go up on the knee. Hold that for 30 seconds to a minute. All right, last two. The next one is called a bird dog. What you're gonna do, you're gonna go on your hands and knees. You're gonna have a nice flat back. Suck your belly button in towards your spine as you do it. Right arm and opposite leg, so left leg, are gonna go straight forward and then come back down, and you go the opposite side. The goal is to keep a nice flat back as you do it, so try not to do one of these. Nice flat back as you go. You don't have to come up very high, just extend back, and then the other side. This works on low back muscles, it also works on the core muscles, which are all important for this. And then the last one is a knee hover. So similar to a plank, but you're on your hands and knees like this last exercise. And all you're gonna do is bring the knees up off the ground and hold. Making sure you're breathing. This is a very easy one to hold your breath during, which is not good for the belly. So make sure you're breathing. You're gonna go up, just hover over the ground with the knees, and then come back down. So try to hold that for 30 seconds to a minute as well. So try those 6 exercises. You'll be pretty out of breath. And I will see you tomorrow. Have a good day.